Right, let's go ahead and jump in. So welcome everyone to our webinar today. We'll be discussing the top 5 things to consider when choosing an accreditation organization. So we're really excited to dive into that. Just a couple of little welcome notes. If you'd like to participate in our webinar, we will have a Q&A session at the end with Miss Christy here. So if you have any questions throughout the presentation, please submit those in the panel. There is a chat section. Those will come through to us, and we'd love to address those at the end. If you have any issues with audio, there's also a drop down for that. If you need to either rejoin or join via phone, those are kind of the 2 best ways to join. Also, just a reminder that you will get a recording of this as well as a copy of the presentation tomorrow in your email inbox. And finally, if you have any questions or want to reach out to us individually, please reach out to us at contact@powerdms.com. So without further ado, let's go ahead and introduce our speaker today. We have Miss Christy Kerwin. We're really excited to hear from her, and I'm going to go ahead and let her introduce herself.
Awesome. Thank you, Vanessa. We appreciate your work on this. Welcome, everybody. We are so happy that you're here to join us with our first Healthcare PowerDMS webinar. I wanted to just give you brief, interesting information about myself. I am, first of all, right now, a SaaS executive, so that's software as a service platform. I've been in that space for approximately 6 years, and in that effect, I look at products and specifically healthcare products and how they impact the healthcare environment. I'm a nurse by profession, registered nurse in the state of Tennessee is where my home is, and I have served in the past at the bedside in invasive cardiology, and then as a director of education and regulatory compliance just before I moved into the business and SaaS space. And then not to be handled lightly, I'm also a mom, wife, and a daughter. So all of those hats I wear very happily. So what are we going to talk about today? We're going to look at a brief history of deemed status and just look at some of the what I call historical fun facts. I am an accreditation nerd by choice, so I wanted to share those fun facts with you and make you really smart at the next Trivial Pursuit if it's ever focused on accreditation. Then we're going to focus on each of the accredited organizations, more specifically in the hospital critical access space and behavioral health and psychiatric facilities. And then we're going to identify some things to consider when you're evaluating changing your accreditation organization, or just evaluating how you can manage that process more efficiently. So quick poll question for you. You didn't know you were coming for some participation today, but I don't want to bore you with my voice. I want you to participate. Quick question, how many CMS deemed status accreditation organizations are there currently in the US? We'll take a moment while you make your guesses. Perfect. All right, so poll results are that there's 1 or 7. You're 50-50 divided. So the answer, the correct answer is 11. So let's take a look at those, the history of those 11 deemed status organizations and how they came to be. So I won't say many moons ago, but moons ago, in 1945, the American Osteopathic Association introduced standards for care and for practice and for accreditation into the healthcare market space. The American Osteopathic Association is actually who we now know as HFAP. So in 1945, they established a survey process and they presented federal standards, and surprisingly so, those standards were in the obstetric space. They were really very keen on what type of care and quality of care did we provide to women that were giving birth. And obviously, if we look back through our history, and we see it even today around our maternal health and maternal mortality numbers and things, that's what spurred that initial development of standards. Then in 1951, JCHO, Joint Commission, at that time, Joint Commission Association on Hospital Organizations, accredited organizations, formed. And they were the first program to receive any type of federal deeming status or deeming authority in the US. And this was actually done without any oversight. So they didn't necessarily have to go to the federal government and verify their standards or verify what they were doing or validate their findings or anything like that. It was pretty much open season. But they were the first authority identified by the US federal government as being able to come in and evaluate hospitals. And interestingly enough, their first 16 standards that they were accrediting organizations on became the original first 16 COPs. So our conditions of participation for the CMS were actually derived from Joint Commission's first 16 standards for accreditation. In 1966, they decided that, you know what, Joint Commission has full authority. We don't have a lot of oversight on them. The AOA said that's a little bit lopsided. We need some checks and balances. So they came to request and were deemed status from the federal government. However, this was not deemed status that Joint Commission was experiencing. It was it had some regulations built around it. They built some rules around how they operated, and they actually had to leverage some of the standards that the Joint Commission, remember those original 16 COPs, they had to leverage that in their evaluation. So the AOA, or HFAP, was granted as the second deemed authority organization in the US. In 1972, so they went through from 66 to 72 with very little oversight. Some parameters, but not a lot. But then the state started saying, you know what, we're seeing a lot of discrepancies, because at the time the states were still coming in and doing their surveys as well. And they said, we're seeing some discrepancies in what we're seeing. And they asked that validation surveys begin. So the state level said, please come in, let's do some validation of these surveys. There's been a lot of surveys and things done, authorities given, that maybe were done so not in the best of light. So in 1972, they said, all right, and at that time, it was the Department of Health and Human Services had oversight of all of the evaluation and accreditation of organizations, healthcare organizations in the US. But they still let Joint Commission hold some of that absolute authority without application. So come 2004, almost 32 years seemingly, still a lot of noise around. There's some inconsistencies. We're not sure that the quality is where we need it to be. The organizations are seeing this more as punitive versus helpful, and a lot of different things. It's not achieving the outcomes that we desire. So they did this report called the GAO report, and it did indeed verify and validate the discrepancies or the disparities in reporting. So DHHS handed over the deeming status authority to CMS, Centers for Medicaid and Medicare Services. And in that transition, they also removed Joint Commission's basic authority, their absolute authority. And they also had to submit application and to abide by a review of the CMS to receive deemed status authority. So jump ahead 2 more years, because what that did essentially is it opened the market. The market then said, okay, now we can bring people in. We know that there's a set of standards, a set of rules, a set of guidelines in which I can receive deeming status as an accreditation body, and then go into these hospitals and healthcare organizations and provide the type of accreditation review that is desired. So in 2008, that's when the accreditation organization competitive market opened. The Joint Commission expanded their market coverage to cover a lot of different service lines, and then 9 additional competitors joined that accreditation organization market. So here comes another quick question. What accrediting organization does your facility use? All right. Joint Commission. And some of you are still using CMS as your primary provider. Great. And that is exactly where the market sits right now, actually. So about 80%, 75 to 80% of the market is still accredited by the Joint Commission. And some of that's through lack of understanding or knowledge that there's other people out there, but also because it covers a lot. So this is a closer look at those 11 deemed status accreditation organizations and the type of facilities that they do accredit. So primarily, you're going to see that there's 4 primary accrediting bodies in the hospital setting, and that's where we're going to focus our conversation around today. But then there's several others that focus on the ambulatory or the ambulatory surgical centers, rural health, HIT, which is home infusion therapy and dialysis, and then home health and hospice. And those are continuing growing markets as a lot of the healthcare provision of the care is actually moving outside of the boundaries of the hospital walls and moving into some of these smaller or ambulatory type facilities. We're seeing a growing number of people become a part of the market for accreditation, but also what I call the big 4 that we're going to talk about today are also expanding their services. And again, we've talked about the Joint Commission being like 75 to 80% of the market for accreditation, and you can see that they cover a lot of things, which helps. So when did these people join? So ACHC HVAP. So ACHC came to the deemed status accreditation through the ambulatory home health and services process. So they did a lot in the non-hospital space. And back in 2020, though, they purchased and merged with HVAP. And HVAP brought with them the hospital and critical access deeming status abilities. CIHQ came to being in 2013-ish with the hospital accreditations, and just in this past year they've added critical access and the psychiatric provision for deemed status accreditation. DNV was the first major competitor that in my space, back when I was in the field doing accreditation surveys, it was the first big competitor that actually organizations were saying, let's compare the two. And that was in 2008 that they started bringing their hospital accreditation forward. And then, of course, you've had the TJC that's been in business since, 1940 something. So a lot of information in that space and a lot of deeming status accrediting bodies, and now competition. And what does competition breed? It breeds a lot of resources for you to improve your efficiencies, your cost, and your process. So my question for you as we move through this very quickly is, has your organization ever considered changing accreditation organizations? I should have put Jeopardy music in. Yes, we are evaluating. Great. So this is good timing then on this conversation. So what are some things that you need to look at if you're considering to change your accrediting organizations? I'd say there's 5 key structures. And the way this came to me is that we were accredited by the Joint Commission, and our leadership, our operational team came to us and said, we are looking to evaluate other accrediting organizations, and primarily it's because of the budget and the cost of the survey. We're looking for ways to save money. So obviously that's always something to evaluate and look at. But there's other things, because each of these accrediting organizations is like a perfect fit for you. And I say it's kind of like buying a house. If you can't go and evaluate the house and look at it and see yourself there and working with this organization, it's probably not a fit for you. If you go into that home and you can't see the bathroom working out for your morning routine, it's probably not the house for you. So it's really important to pay attention to what is your organizational strengths, and then what is the organization offering. If you just do it based on budget, you may be let down. But if you do it based on all of these things combined, it's going to be a better fit for you. So what are your own personal organization strengths? What are your own desired outcomes and approach to this process, to the accreditation process? Is it very process oriented, or is it very quality oriented, or do you prefer an educational guide, a guide on the side approach to the process? How often do you want to be preparing for survey? What is your organizational cost and spend? And we're going to talk about some of the other fees that are in it outside of just the cost for the general accreditation and process. And then also the use of innovation and technology. And that's going to be where we talk about different things that can help you prepare and things that they offer, the accrediting organizations offer, and things that platforms such as ourselves offer as partners of these organizations. So let's jump into this more specifically. So here's a good grid or a general overview of how you should take a look and just step back in the process before you even start pulling information in from these organizations and ask yourself a few questions. The first one, as I said, is focusing on your organizational strength. And I've identified where each organization with organizational strength, which organization best fits that market. So if you consider yourself a patient-driven organization, and what I mean by that is you build services around the patient. So you have durable medical goods, you have pharmacy compounding for home health medication deliveries and different things like that. You have very patient-driven services. Remember, that's where ACHC came into the market. Their secondary component of HVAP of acquiring that is now in the hospital setting, but they still carry on that torch for patient-driven services and the things that we build around that patient. If that's where you are, they are a wonderful fit for you. Their approach is very educational. Yes, they have standards and guidelines. They are accountable to the federal government for their outcomes, but they take a very educational approach. They have a lot of different academies and things like that that they offer to their accredited organizations, and a lot of different opportunities for you to participate in learnings and how they disseminate that information to you. They do their surveys every 3 years, so it's just like if you're joint commission, which most of you said you were, and you're looking to transition, you're not looking at any differences in the variety or the numbers of surveys that you're going to have. But the biggest thing is from an organizational budget and cost perspective, they are much cheaper than your joint commissions DNVs. And what you then have to look at, because you can see that CIHQ and ACHC have similar dollar signs from a cost perspective. If you wanted to do an apples to apples comparison in that, see what is involved in that cost. Some of the fees and things that catch us by surprise that some of these organizations include in their cost is like your reaccreditation. So if you have a follow-up survey, if you have to have that, do they charge for the initial survey and the follow-up survey? And those charges could include the survey itself as well as the travel for those surveyors to be on site. So it's really good to ask questions like, does this cost include travel, or does it only include the survey itself? That way you can look for those additional fees when you're actually looking at what is this going to cost us. Other things that you can look at in this organizational and budget cost information is, do they include the standards, or do I have to purchase those standards? Do they require that I submit all of my information through a technology tool, and then do I have to purchase access to those tools? Or does all of that come included in the cost? Those are just some things that you can evaluate and determine whether or not that is, if it's budget conscious or budget friendly for you. And then the last thing on the list for me for ACHC is how do they manage innovation and use of technology? Do they have a separate revenue arm that builds e-tools and that builds different technologies that are sometimes mandatory, sometimes not mandatory? Or do they partner with people in the industry such as PowerDMS or other agencies to provide tools to help increase efficiencies, which gives you some decision making and of how you're going to manage your internal processes? And then also, do they offer consulting fees, or not consulting fees, but consulting services? And then the question that goes into that is, are those consulting services included in our fees, or are they an additional option? ACHC offers a variety of partnerships. You can go on and see who they select to partner with to provide different levels of efficiencies in their programming process, and they do provide consulting services for fee. CIHQ, organizational strength. If your organization is very evidence-based practice focused, and what I mean by that is your organization enjoys setting up centers for excellence. You enjoy setting up certification programs and receiving certification emblems and different things that really show that we're putting our best foot forward in different areas of services that we provide to our patients and to our community. They are very strong in this space as they offer a multitude of centers of excellence certifications, as well as additional certifications like your stroke and other things that all of these offer. But they have different levels of certifications that you can continue to obtain to. And all of that is based in evidence-based practice. So if your organization is very big on that, and I say if you have the way you can tell is if you have committees built around practice and things like that. If that's big in your area, you're an evidence-based practice-driven organization. If your desired approach and outcome to a survey is educational, they're going to come in, they're going to provide for you what's going on. They're going to tell you what you did wrong and how to correct it. And then they're going to work with you through the process. Again, that's a very educational process. If that's how you desire to be approached and how your approach to the survey process is, these are the guys for you. Frequency of survey, again, is every 3 years. And organizational and budget cost is very similar, but something that's very different for them. We talked about travel expenses and things like that for follow-up surveys, for complaint surveys and things like that. Many of their fees is a static fee. They charge you a single fee that covers everything. And if there has to be a complaint survey, they'll tell you this just includes travel or this just includes XYZ. They're very upfront with their cost and pricing. You can find that on their website. Their innovation and use of technology, again, they work through partnerships, organizations such as ours, and then they also have their ARS consulting arm that they offer consulting services through. And depending on your organization size and things like that, that is often included in your fees for accreditation. So definitely something to look into. D&V, I think I saw a couple of you may be D&V accredited. D&V is very data driven, and if you've been through their survey process, you understand this. ISO 9000 is the data piece of and that's the primary hurdle that you have to jump. And I won't say hurdle because it's actually a good exercise, but you have to get past that before you receive accreditation. So very data driven. You have to have an organization that has the capability and understanding around what data you have access to, how you can report it, how it is reported, and at what level of transparency that is open to the organization, because they will challenge you in every single aspect of that, which in that regard, their desired approach to the process is very process oriented and very quality and outcome driven. So it is very like, here's your process, let's go make sure that that's what your process is. That's your rounding and surveying during survey. And then is it giving you the outcome? Is the quality where you want it to be? And that is something that is very well ingrained into their process. Initially, when you're doing survey with D&V, you're going to have to do that 1-year ISO evaluation one time a year for 3 years. Once you receive that certification, you then move into every 3-year cycle. And then that's their NIHO accreditation. Organizational cost-wise, it can be a little bit more expensive. And that's where kind of the rubber meets the road for some organizations, because the data and the quality aspects of just maintaining that level of it tends to be expensive and inefficient. Unless you have programs that can help manage that information for you, it can be very resource intensive. So it double whammies people. They forget that there's an expense on maintaining that level of quality attainment or data attainment, and what the cost of the actual services for the accreditation process are. And the way that they manage their innovation and use of technology is through partnerships primarily. They do not have like large, robust revenue arms that build tools and different things like that. They will give you templates. They will offer recommendations on site and things like that, but they really do leave that up to you to go out, and they will openly say, we partner with these people. They can help you with this piece or that piece, or here's how you do this or that. But that's how they manage theirs. Again, it's a very data and business, I say it's very business focused, and that some organizations really appreciate that. Last but not least is the Joint Commission. And this is growth driven. So if your organization is very growth driven, and right now in healthcare, this is huge. Everybody is acquiring everybody. And if they're not acquiring, they're merging or they're sharing services, etc. And because of the Joint Commission's expansive reach, and they have a lot of different areas that they have deemed status, for accreditation in, they can be the one-stop shop for you to do the full span of your business and your organization. So again, if you are very growth driven, that's your strategy, and you need a lot of different services accredited so that you can have billing and things done for those services, the Joint Commission is your choice. These other accrediting bodies are kind of limited in the spaces that they are deemed status as of right now, but they're always putting in applications to expand that. But that's where Joint Commission is the leader in the space for sure. Their desired outcome and approach is process and quality. Again, the construct of high reliability came 100% from the Joint Commission, and they've really moved into the process and your leadership involvement in the process and how they manage and provide oversight into the outcomes and the quality in your organization. So it's very process oriented. They're going to come in, they're going to see what you say your process is, they're going to evaluate that process and make sure you do it, and then they're going to look at your outcomes to make sure that they align. So very much like the DMV. And the frequency of their survey is again every 3 years, and that's just a basic survey. If you have if you build a new site or you add a new wing or you add new things, they may come in and do interim life safety surveys or things like that, but that's between you and them on how often they have to do those and your state. From an organizational and budget cost perspective, TJC still tends to be the most expensive. And some of that is because if you look towards the innovation and technology pieces, there's a lot of technology and e-tools that they've built into their platform and into the part of their process where you have to submit information, you can do your mock surveys and different things on their platforms. You're sending in your PPR and different things electronically now, your application statuses. A lot of that is now done all technologically. That comes at a cost. So obviously their fees are specific to that. And then other fees that come into play is for your certification and certification evaluations and different for cause surveys and things like that come for fees. And one of their big fees is travel. So you may pay your initial fee for accreditation, but then you also know if you're doing the budget that you better plan for at least 3 or 4 surveyors for travel. So that's going to increase that allotment that you're spending years 1 and 2. You're spending that on 3, but you're also spending in excess of that in travel and time on site. So just make sure you're bringing all that into the core picture. So last question that I have for you, I promise. What would be your biggest barrier to making a change? Would it be that I wouldn't even know where to begin? Like, it's just right now our process is so out there and inefficient that it almost makes me nauseous to think about it. Or do you work in a change averse culture? So buy-in would be difficult. Not only would changing to a different organization be difficult, but so would just getting the support and help needed to make that transition. Or are you just happy, but yeah, we kind of need some assistance with our accreditation. We're always open to conversations that would increase our efficiency. Yes, that lovely buy-in, working in change averse cultures. I think that is the culprit of most work that we're trying to do to try to get our organizations to think beyond today, is getting that buy-in. Well, the good news, and this is the sales pitch portion for my webinar today, and sales is not my space, so it's an awful pitch of that, but let us help you. Our platform, we didn't talk about it very much, but what we have is a policy and accreditation document management platform, and what we help do is organize all of your information related to accreditation process. So on one side is the policies and all the things that you need to validate and show documentation that yes, indeed, you are you're having all of the things in place that you're supposed to have in place for accreditation. We attach those to those standards. You attach your policies to the standards. And then when those standards update, as you know, with all of these organizations, they either do that every 6 months or once a year. And then if they have interim changes, CMS decides they're going to make changes, it may be once every 3 months. When those changes come in, we update that on our platform and you get notification that there's changes in the standards. But not only are there changes in standards, these are the policies or the documents or the audit forms or whatever that situation may be, your building plan that is attached to this standard. So you also need to evaluate that to make sure it's still in compliance with the changes that have come about. So that's the premise of our platform, and how that would work is if you are deciding to make that change and you're needing to import what you have currently from your evaluation and your last accreditation with the Joint Commission, if you're going Joint Commission to CIHQ, we can load in your assessment and let you perform your assessment from Joint Commission, how that went the last time, add all of your proofs, and then we can also let you view and add in the standards from CIHQ. And then that's when you can start doing some crosswalking and compare and contrast. And a lot of the same, remember, they're all based on the CF42 CMS guidelines, COPs. So you can start comparing and contrasting, and you'll see that the lift that is needed is not as bad as it seems. Now, with buy-in, getting that buy-in, our sales team is really good. They can provide some things for you, such as ROI tools, to show you how you're benefiting from a cost perspective of making the transition. Even if you're not looking to transition to a different accrediting organization, we just need some help in supporting and managing our accreditation process. We can provide ROI tools, we can provide business cases for you to take to the CFOs, anything that you need to kind of help drive that buy-in and do real-life demos for them and make it applicable to their department. So we're here for that. Please raise your hand, let us know if that's something that you'd be interested in. And that's all that I have on that for my sales pitch for my presentation. Please, if you have any questions, type those in the box. We'll get those answered.
Awesome, thank you so much. We don't have any questions now, but we do have some comments saying thank you so much for the information. So that's super great. If any of you who just joined us or are interested in talking to our team, please reach out at powerdms.com, or you can email us at contact@powerdms.com as well. So again, thank you guys so much for joining us. Thank you, Christy, for that presentation. And we hope that all of you have a good rest of the day. Thank you so much.
You're very welcome. Have a great day. Bye.